Tell me when.
Yep, you are good to go.
All right, good morning, everyone. The October meeting of the Audit Committee is hereby called to order. It's 8:03 by my clock. It appears that everyone is here, although Rhonda's apparently having camera trouble. There we go. Yep. Morning, Rhonda. Oh, off again. I do not expect Alderwoman Tierney to be here. She apparently has some medical issues. Is going to have a little bit of surgery on her wrist this morning. She took a nasty spill last week, and well, I don't know exactly what happened, but she does have some injuries to take care of. Everyone else appears to be here and ready to go. The first order of business is the approval of the minutes. Now we have two sets of minutes to approve. One's from our October meeting. Has everyone had or anyone had the opportunity to review the minutes from our last meeting?
Mr. Chair, can we approve the agenda for today's meeting and then get to the minutes?
Okay, that's actually not on the agenda, but it should be. Do I hear anything regarding the agenda?
Motion to approve.
Second.
Right. Any discussion? Seeing none. All in favor signify by saying aye.
Aye.
Aye. Any opposed? No. All right, the agenda is approved. Now we'll move on to the approval of the minutes from the first from the September meeting.
Mr. Chair,
Yes, Mr. Cardillo.
I request the following amendments to the September 20 meeting. With regards to attendance, can we please indicate that the chair from Ward 2 is present? Can we change the position of Alderwoman Pindell Charles to Ward 3? And can we change the position of Alderwoman Tierney to Ward 1?
All right, do I hear a second?
Second.
All right, discussion. Alderman Cardillo, I mean, Alderman, didn't mean to insult you like that.
No offense taken, sir.
All right, is there any discussion about that? Seeing none, all in favor signify by saying aye. Aye.
Aye.
All right, let the record reflect that the minutes for the September meeting are approved.
As amended.
Let's go to the June agenda. It was considered at the last meeting and we agreed to postpone it. I think we have gotten, in the meantime, some statements, correspondence from Kim Moronsky indicating that, well, she also sent a copy of the minutes. Any motions? Mr. Cardillo. I think you've been muted. Jim, you're muted.
Motion to approve the June 21 minutes.
Or here a second. Any discussion? All in favor signify by saying aye.
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 All right, the June minutes are approved. The next item on the agenda are new business. Annapolis Fire Department. Good morning, gentlemen. The format we usually follow is that we give a brief statement from our guest speaker, department head, and followed by questions from the committee. In this case, however, I think we'd like to discuss the performance measures. And well, first of all, Chief Romali, good morning.
Good morning.
Perhaps before we do that, maybe for 5 minutes, you could talk about the department in general. What are the functions? What do you do? I know you put out fires, but maybe explain to the committee what the function of the department is and how you go about spending your money.
Sure. Good morning, everybody. With me is Deputy Chief Carol Spriggs, who runs operations within the Department of Emergency Services. So the Annapolis Fire Department is a all hazards emergency services agency. We handle everything from fire and EMS calls to water rescues, hazmat incidents, to getting cats out of trees, if that's the case. I can tell you that when people don't know who to call, they call the fire department. So we run a wide majority or range of calls. So our department, as you know, with city budget, is one of the larger departments. Public safety has the 2 largest departments. We're authorized 140 some people. We operate out of 4 fire stations: the Eastport Station, the Taylor Avenue Station in West Annapolis, the Forest Drive Station where our headquarters is here, which is across from Safeway at Bywater Road, and then the Annapolis Next Station we share with Anne Arundel County. So that building in the Annapolis Next Station right on the peninsula is owned by Anne Arundel County, but we share the building with them. So they staff an engine crew there, which staffs the engine, which is a tanker pumper because there's no water on the peninsula. And they also operate the county's dive team. In that station, we run a paramedic unit, which is an ALS unit, advanced life support, and our EMS supervisors. So it works very well that we share the station because the majority of calls that station runs are in the city of Annapolis. We had some response time concerns with meeting the national standards from the Eastport Station getting to the end of Edgewood Road area. And that helped us eliminate that to be able to get to those response to areas a lot quicker. It works well, and it's a good combined opportunity working with our partners in the county. So our firefighters on the shift there, they work a 24/72 shift, so they're there for 24 hours a day. And we need a minimum of 25 members working every shift. We only have 30 assigned to a shift, so that allows us to have 4 people on annual leave. And then anything else, sick leave or educational leave, is at 1 spot. Anything past that causes us overtime. It's been very challenging over the last 2 years. Chief Spriggs and I have been in the chief and the deputy chief's position for 2 years now. And I can say that our tenure has been an absolute challenge with the pandemic and a lot that's going on in society. It's caused a lot of stressors on our department working through the COVID. But I can assure you that once that we never skipped a beat. We've been here every single day running calls, and we've had to adjust to some of the challenges that come along with that. But we've had people here every day. We run an average of 12,000 emergency calls a year, up to from January to August of this year. We have over 8,000. The majority of those, 70% of them, is EMS calls, where we're taking people to the hospitals. But the stations themselves, what makes us so unique and so great are the people that work here. You have a very good core group of individuals that are very dedicated to serving the citizens of Annapolis and our visitors. And they wear multiple hats, and that's what allows us to provide so many services that we do. Just take, for example, the Eastport Station. We run an engine, a ladder truck, and a medic unit out of there every day. that engine company also cross-staffs our fireboat. I know that the people in the boating community see our fireboat on the water quite a bit because we get calls, especially this time of year, on the Severn River and out in the bay. So that engine company cross-staffs that fireboat. That ladder truck there cross-staffs our peak time medic units. So when we run out of medic units, and we run out of medic units on a daily basis, that ladder truck crew gets off that ladder truck and they run a 5th ambulance to the city. Our Taylor Avenue station's sort of the same way. They handle our special operations calls. They handle hazmat, confined space, high angle rescue, and they also have swift water teams. So if a car gets stuck in high waters, rushing waters, so that team there would go out and get them. The crew at the the Annapolis Neck Station, as we talked about, is the joint station. Some of our members there are on the county's dive team, so that joint ventures there. And our busiest station is the Forest Drive Station, which is out here in the Pearl area. So we run 3 engine companies, 2 truck companies, 4 medic units, duty chief and a duty EMS supervisor every day. And then just to go into the ancillary duties, we have a fire marshal's office that handles all code enforcement issues in the city of Annapolis. That goes from plans reviews to building inspections. The other half of the fire marshal's office does our fire and explosive services. So every fire that you run has to be investigated. So those investigators are cross-trained. They wear multiple hats too. They're full law enforcement officers. They've been through a police academy, and they also are bomb techs and have our explosive detection K9 teams. And then we have some smaller units like our training division, which is a training division of 2 people, which is out there. And they're actually running a recruit school for us right now. So it's very challenging, but we tell everybody our department's too big to be small and too small to be big. So we have an excellent department, a number of people working here, wear multiple hats, and they can handle any emergency that's out there. Just with our budget itself, real quick.
Okay.
90% of our budget is all personnel costs. So that's where our costs are. It is all personnel costs, and that's for us to staff these units every single day and get units on the street. When it boils down to looking at our budget, while it's a large budget, when you take away fuel costs and maintenance costs, we have just over $1 million a year to operate these fire stations and this apparatus. And our people do a good job with that. But I just like to remind everybody of that, especially you all being on the financial committee here, that's it. Our costs are all personnel costs. There's really not a whole lot more there. And I believe we do a good job with what we have to maintain our budget.
Does the department have any certifications?
So we are an ISO class 1 fire department. So the ISO rating is done by the insurance agency. It ranges from 1 being an excellent department to a 10, which is very little fire service altogether. We are an ISO class 1 department, and we're very proud of that. And that does help with some of the insurance ratings for our business communities and some of our homeowners out there. But it's evaluated by that service.
How many other departments in the country are have the #1 category?
Chief Spriggs, do you know what it's up to now?
I think you might be muted. I can't hear you. Chief Spriggs?
So I heard him say that we are one of only 2 in the state of Maryland. And the numbers are growing a little bit. I'm not sure what the total numbers are anymore, but there's only 2 in the state of Maryland, and we're one of the 2.
All right.
I can go into
Okay.
our procurement standards if you like, real quick, and then we can go into any questions. We can breeze through these. If that's what you
Okay.
want to do.
Go right ahead.
All right, our #1 goal, and Chief Spriggs and I were definitely in tune to this when we took over the organization here, is firefighter safety. Firefighter safety is our utmost important goal for the department. Everybody knows that. We stress that every year. We have concerns about cancer in the fire service. It's become a very large issue. So we are looking at everything we can do to reduce the cost of workers' comp claims, but ultimately it's all about the health and safety of our personnel. So the goal for that is firefighter safety to enhance the health and safety of our personnel. We want to do that by reducing the on-the-job injuries, reduce our workers' comp claims, and we have a accident review board that investigates all accidents. So we can determine if we have multiple back injuries, what we can do to prevent those. And over the years, we've had those occur. We've changed our stretchers that we carry people out of buildings on. They have lift assist capabilities with them now. They're battery operated. So that's helped us with some of our back injuries. Also our stair chairs where we have to bring people out of second floor, bring them down. The stair chairs are made a lot different now. We've gone to the top of the line ones to help us with removing people from structure. So things like that get looked at. All our accidents, while I can't say we don't have any accidents, as you know, our streets in the city of Annapolis were built for horse and buggies, and now we're taking large fire apparatus and medic units down it with cars parked on each side. On occasion, we have tapped a mirror or two and hit a street sign, but I am proud to say that the accidents we have tend to be relatively minor, but we look at each one of those two to determine what we have to do there. To help evaluate those. We do retraining. All of our operators go through an emergency vehicle operators course. But as you can see for our workers' comp claims and our injuries there, our accidents there, we had 2 in July, 1 in August, 4 in September. So unfortunately, September wasn't a good month for us. But that's our averages. And I can assure you that we look at each and every one of them and really define what the problem is. Our second goal there is to minimize the impact of fire and injury, and it's in our action mission statement. So we try to reduce that, and our tracking mechanism for these is that we're tracking our turnout times, our response times, the number of hours, or not say hours because it feels like hours all the time, the number of time our units are at the hospital offloading their patients. That is a national issue right now. It was an issue before COVID, but once COVID hit, it made it even worse. Where unloading our patients at the hospital to get our units back in service is sometimes a very large challenge for our department, which means we're not available for the next call. Somebody else has to handle that. So you can see that the national response times are an NFPA standard. That's the National Fire Protection Association standard. That's the goals we try to meet. I can say that we do meet them. The goal is to meet them 90% of the time. You can see our averages on here. We meet those. So what we don't necessarily meet is the turnout time. And there's some reasons for that because we want our people to be safe getting out of the building. So our turnout time there, NFPA standard is 60 seconds for an EMS call and 80 seconds for a fire call. As you can see, we average about a minute and 28, a minute to 30 seconds. But we also want our personnel to know where they're going before they get in the apparatus. We want them to know before they're on the street trying to look up the maps going down the road. So that works well for us because our average response time, once you hit the street from the time we go responding, is supposed to be within 4 minutes. And as you can see, we meet that standard very, I'd say almost 98% of the time. So we're definitely meeting it 90% of the time. So we have very good response times in the city of Annapolis. I think that the people living here have come to expect that. We know that when you're on the scene, and it's even the same for us, if you're on the scene of an auto accident and you're waiting for somebody to get there, it seems like 15 minutes. And it's even us. If we pull up on it and we call for help, it seems like, man, it's taking them a long time to get there. And then we look at the response times and we're right on top of things. So we're proud to say that we get there quickly and we provide that service. So with that, it's there's an 8-minute goal to have an ALS provider on scene, which is a paramedic. We definitely meet that because on the majority of our units, we have an ALS provider close by. So we are meeting it, but the goal is to have an AED or a first respond, an AED on the scene within a certain period of time. All our units are capable of that. All our employees are at minimum EMT level certification. And then a full box alarm assignments where we have a structure fire and we have to have a certain number of people there. You're supposed to be there within 8 minutes of time, and we're meeting that with at least 15 people. I told you about the hospital wait times. Well, if you look at our averages, they don't seem too bad. There are times where our medic units are sitting at the hospital for over 2 to 3 hours waiting to offload the patient to get into bed. Our hospitals are on reroute all the time. We will go to the closest hospital if we can, but if Anne Arundel's on reroute, we will go to BWMC, we will go to Baltimore, we will go to Prince George's County, we will go to Queen Anne's County. We have to look at what hospitals are open, and sometimes it's easier for us to travel to this hospital, unload the patient, and get back than to sit there. But there are average times, and that's just the times of unloading the patient. It takes about 15 minutes, more 20 minutes to get the unit back in service to write the report before they go. But that average there is a problem. I can assure you we're working with the hospitals. We're working with our counterparts in Anne Arundel County Fire Department to try to address it, but it is a nationwide problem that is hard to address. And as you see, we have the ISO Class 1 rating, which we're very proud of. Our next goal is to have that 25 people working every day. We call them soft vacancies. Soft vacancies hurt us. I explained to you that we only have 30 assigned to a shift. We need 25, so it only gives you 5 people to play with. We're allowed to have, for 6 months of the year, they're allowed to have 4 people on annual leave. For the other 6 months, 3 people. So we always have people off. They're always, they earn time off and they need the time off. But it becomes a challenge to us when we have all these people that are either vacancies from people leaving the department, retirements, or taking on other jobs, to long-term injuries, to pregnancies, to FMLA. I mean, that all plays factor into it. So these are just the average numbers of what we've had in their positions, and we track that every month. So we are proud to say that we have not had any recorded cancer claims recently. We have had them in the past, but it is a problem in the fire service that they're finding with the what's materials used to build our buildings these days in cars. There's plastics and everything. There are several cancerous type of materials out there. While we give them the best SCBA, self-contained breathing apparatus, and turnout gear around, the byproducts of these fires can sometimes be a problem. Now, we've addressed that. We have policies in place where at a fire scene, they have to decontaminate their gear before they take them off. We don't have the budget to give everybody 2 sets of gear. So if they go to a structure fire, they don't have a second set of gear to use while they are cleaning their gear. We have extractors in each station. We've been able to do that through our cancer initiative, so we can clean the gear in the stations. But what we do have is an adequate supply of spare gear that they can go to our logistics office and get gear while they're waiting to clean their gear. Ultimately, it would be nice for everybody to have 2 sets of gear, but that also creates a storage problem for us, and it is a budgetary issue because the firefighting turnout gear has to be replaced within every 10 years. We inspect them monthly, and then they have every 6 months, the department sends a person around and inspect them. The individuals inspect their gear on a regular basis. Number of paramedics, ALS providers on a break, on a proficiency enhancement is what we called it, but basically it was a break off the medic units. We're finding that a lot of our medics don't feel that they have the opportunity to do other things like ride fire apparatus. They feel like sometimes they get stuck on the medic units. We have a goal of having 12 ALS providers per shift. We are not there. It's going to take us a while to get there. We average about 8 per shift. So I told you we have 4 medic units in service every day. So you need at least 4 paramedics on that. The 5th one for the that peak time unit. So there's 5 of your 8. So if people are on annual leave, they can't get a break. We started an enhancement process where they were actually guaranteed time off. That wasn't working for us. Our chiefs got together and they are handling that within a shift. So as you can see, that one performance review, there's nothing in there about it. I can tell you that medics are off on a regular basis. We track it, but it's not an enhancement cycle where they're scheduled time off of the unit. But they are, because they're cross-trained, they do multiple functions, and they do get their enhancement on fire apparatus, because we want them to be proficient in their entire job, not just, because we don't have just medics. All of our firefighters are cross staff, so our EMTs are cross staff. So it's not just that we have medics on the medic unit and that's all they do. The next one's our training hours. That's, we track every month. We have mandatory training, and then that is also part of our ISO rating and the NFPA standards on training that needs to be done every year. But we have to do annual research for our medics, for our EMTs, for hazmat refresher. We have all kinds of OSHA compliance training that needs to be done. So all that plays into it. The next one's just a public education is one of our goals, to get out there and train people. With COVID, because we haven't had groups together, then a lot of our events were canceled. The numbers have gone down, but we have a lot of programs out there, from kitchen safety to fall prevention for the elderly. But one of our biggest ones that we push these days is called Our Lives Matters. It is a combination of stop the bleed, hands-only CPR, and Narcan, because our overdose rate is still high. Our overdose fatalities in the city are still high, and we run overdoses on a regular basis. So we train people how to give Narcan when it comes to that type of drug that can be counteracted with the Narcan, the opioids. But that's one of our programs that's out there and available for the community. And the only other one is, we talk about hospital wait times. We've been looking at alternatives of what to do. There's a program out there called paramedicine, where some of the, we call them frequent flyers, some of the people that utilize our service on a regular basis but don't necessarily need to go to the hospital. We'd like to be able to help them with some mental health and some other avenues there. So we're looking at that type of program. But what we have done is we started an alternative destination program, which is approved under our protocols. We have partnered with Right Time, which is part of the MedStar Corporation. And years ago, I'd tell you that our medics would never be taking somebody to one of these primary care facilities, but that's what we're trying out. So our low priority calls, they have a threshold that they have to meet. So they have to go down this checklist. But if they meet that, we can take them to like Right Time for treatment. And we are also moving into telemedicine. We're on a unit that we can pull a doctor right up on our iPads, and between the doctor, the medic, and the patient, determine whether or not some treatment can be done at home and they don't have to be transported to the hospital. But all in all, that's our goals. I know it's a lot to take in, and we can answer any questions you have.
All right, Alderwoman Pendel Charles.
Thank you, Mr. Chair. Several things. And first of all, as the council's public safety chair, I'm really proud to be your chair and to work closely with our fire department. I mean, I can't say enough about what they do, how they operate, and the professionalism that they serve each and every day, every hour of the day for us here in Annapolis. Couple of things. Number one, firefighter safety, as you indicated, is a priority. And I would assume that translates also into patient and resident safety. Because if our firefighters aren't safe, they aren't able to perform their duties that assist our patients and our residents that they serve each and every day. And I'm going to assume that's correct, Chief.
That is a correct statement. That's part of our public education programs. And when we do run calls to residents' houses, if we see a need for other people to get involved, like social services or some of the other programs that are out there, we work a lot with the county crisis team when it comes to mental health. So we work all those aspects. But yes, it's about the safety of everybody involved. But if our firefighters aren't safe, we can't provide that service to anybody else.
Exactly. Now you indicated about the paramedicine and Right Time and telemedicine. Have you had any interactions? Do you work or have had any communication with our licensed clinical social worker on that front?
So we have worked a little bit with her. Our EMS division talks to that new group in the mayor's office there, the social worker. So we're still getting in there. They're getting that program up and running. So we're interested to see how that goes in the future.
Okay. The other thing is too, you mentioned your different outreach programs, and we had talked about this and COVID hit. So we've done a couple of things with youth. As far as I recall, a couple of years ago, I guess it was 2 years ago, you and Deputy Chief Spriggs worked on a youth program where children, we realized, don't really exactly know what the fire department does. And so that was a great tool, even at some point, for recruitment of our youth. Any updates on that? Like I said, I know we've had a lot of challenges over the past 2 years, year and a half, but anything on that front?
Not since, because of the challenges, we haven't been able to get out in the community the way we'd like to. But we are involved when the summer camps and the pop-up camps, and our people in the fire marshal's office where our recruiters are, they go out to these events and they continue to educate what the department does. We have some other ideas of what we'd like to do in the future. It's just a matter of getting there.
Other thing I want to mention, earlier this year, and I think this is worth mentioning, that the chief brought to my attention, I think it was back in the spring, and they had an event over at the Eastport Community Center. And some of the challenges were getting people trained in Narcan, and that was on a Saturday. And it was a little difficult to try to push and pull to get folks to participate. But like I said, that was on a Saturday, and the chief indicated to me 2 days later on a Monday, I think it was 3 people that were administered Narcan who was saved based on that community outreach that they had at the Eastport Community Center. Correct me if I'm wrong, Chief, or add anything you'd like to add.
No, that's correct. We had an event there where we did that Your Life Matters program and actually issued some Narcan out after the training. And some of the individuals that were trained that day used the Narcan within the next couple of days to actually save the person's life. There are multiple occasions, and people don't realize it, that these people are not breathing, and sometimes their heart's not beating. And the Narcan is the quick interaction when it comes to the opioid issue that's out there. So it does help, and we push it out into the community as much as we can.
Right. The other thing, last thing I want to mention, and if you feel comfortable in answering this question, if not, please don't. As far as we've had some conversations about folding into the Anne Arundel County Fire Department. If you don't feel comfortable in answering that question, please don't, Chief, but I just want to throw that out there.
Well, what I can say about it is I know that they're gonna look once again. I've heard about this multiple times throughout my career, my first and second career. I can tell you that the citizens of Annapolis are accustomed to a certain response times. I'm not sure how that would be impacted if we did. What I can tell you is we work every day in and out with our counterparts in Anne Arundel County and the United States Naval Academy, which is Naval District Washington Fire Department. And to combine those services, we would probably lose services because we wouldn't have as many out there. Anne Arundel County's got to look at the entire county. So they're going to look at how they run things throughout the county. I don't know how they would staff our stations if they did have the opportunity to take it over, but there's a lot of things that would have to be looked at. So I can't say, either way. I personally, as a city resident, I think we would be losing out. I think that we provide the services that our customers expect to get, and I don't know where it would be.
The other thing, just one added tidbit. Thank you, Chief. One added tidbit. We do have I won't say luxury, but we do have quite a few persons within our fire department who are very familiar with Annapolis, either grew up in Annapolis or went to school here. But I think that's a true benefit when it comes to being very passionate about the services that they provide. correct me if I'm wrong, Chief.
So we do have a core group of individuals that are born and raised here. They are definitely part of the community. One of which actually is the coach of Annapolis High School's football team. So, we're very proud of Firefighter Hunt, which is Coach Hunt for the students at Annapolis High School. And he is just one of several people that are born and raised here. I can proudly say that I am one of them also. That's why it makes me so proud to be able to give back to the community that I was raised in, because I love this town.
Thank you so much, Chief and Deputy Chief Spriggs. You're doing a magnanimous job. Appreciate it.
All right, Ms. George.
Thank you, Mr. Chair. Chief, just a couple of questions for you. Internally, do you all maintain metrics on how many of your calls are overdose related?
So we don't maintain a call volume on just the opioid overdoses. We can look up overdoses, but when we run overdose calls, that could be somebody took too much medication, could be alcohol. So yes, we can look at that. We can pull that data. I don't have that here, but that data would not just be opioid overdoses. That would be all kinds of overdoses, because we don't track it that way. Now, our emergency management has that dashboard that's out there about the opioid crisis, which we report to and the police report to, but the police would track more of the opioid type of overdoses compared to all overdoses, because we run a wide range of medical calls.
And as you say, overdoses could be lots of different.
Absolutely, and that's where it's hard for our records, and we bring that up at the Public Safety Committee meeting all the time, because when everybody else is looking at overdoses, they're looking at our opioid crisis and the amount of times Narcan's given, but we run all kinds of overdoses, some accidental, some intentional. So yeah, that's our numbers would be skewed there for that.
Do you all perform inspections on multifamily units? Certainly, there's a very large multifamily property in Eastport. And I come from a city where annual inspections were done by the fire department of those kinds of dwellings. Do you all do that?
So depending on the occupancy type is the only thing I can tell you there. So if it's a single family dwelling that has multiple residents within that, the fire department has no control over that. That would fall more under the planning and zoning. And if it's a rental property, now we work with the rental inspectors all the time to make sure that but that's if it's a licensed rental. If we run a call and we believe that it's being rented and it's not on the city database, we'll report it to planning and zoning. But for the most part, those buildings don't fall under our preview. That's the purview. That would be more of the building department of planning and zoning.
Okay. And then looking ahead, I understand all the departments went through some training regarding performance measurement. Do you see any new performance measures that you all will be tracking in the coming fiscal year that we haven't seen today?
So we worked with the group that you all had actually recommended and the city put together. What we were told by that group was that our performance standards are pretty much on par. They made some recommendations. It's hard for us. We don't have those goals because most people, when they're looking at the performance views, they want these hard numbers, and it's hard to do because we're out there responding to emergency calls, and but we have worked with them. I don't know that and you see anything majorly different with the performance reviews than we have now. They will change, but it's basically tracking the same type of information.
Tracking the same things. Okay.
Yes, ma'am.
Thank you very much. And
Sure.
Thanks for all you do. You make a lot of calls over to Nautilus Point, and it seems like your response time is really quick. So we thank you.
Well, I can tell you that our crews are steady throughout the day. They're not laying around just waiting. If they're not doing something, they're training or they're doing something else. They stay busy.
Thank you, sir.
Mr. Cardillo, I believe you had your hand raised a few minutes ago.
Thanks, sir. Chief O'Malley, Deputy Chief Spriggs, thank you very much for putting this together. I appreciate your time and effort, both in the preparation and in the meeting time. A couple of things. You mentioned about these traffic accidents. I am going to assume that not all these are the responsibility of department personnel. Is there anything the Public Information Office can do to educate the vehicular public out there to pull over when the emergency vehicle is present? I don't think all the incidents are caused by department personnel.
Well, that's a good point, and I did not state that the accidents we're involved in are not all our fault. By far, they're not all our fault. We do work with State Highway Administration, with the city PIO, to try to get things out there. You know, this state's got to move over a law where you're supposed to move to the right. But as much education as we put out there, we need our people to be quick to react, because sometimes people get scared. They don't pull to the right, they pull to the left, or they slam on their brakes right in front of you. We can continue to try to push that out there, but that's a hard one to try to get through to the community.
Yeah, I guess I'm wondering if there's a way to say, like within the number, just a number of accidents, 9.25, given the number of miles that emergency personnel are driving at fire department, is that where you want to be, or is that not where you want to be in terms of the number of miles driven on calls or returning from calls, or
So where I'd like to be is 0 accidents, but we all know it's not going to happen. Yeah, I don't know. I haven't looked at it that way.
Okay.
It varies. I'm telling you, a lot of these are this very minor. They bumped a mirror from the medic unit on a truck as they were trying to squeeze through, or going around State Circle. Somebody wasn't real close to the curve, and our exhaust actually pulled the bumper off the car. I mean, it's things like that that drive us crazy. But what we also have to remember here is that we require them to report everything. If they scratch the side of the medic unit because there's a sign hanging over, we put that down as a vehicle accident just because we want to know. So that's why sometimes it may look a little higher than it actually is. But as for major accidents, and I'm knocking on wood because you never know what's going to happen, we're pretty good. Our drivers are pretty good with reacting with their speeds, and we watch that too. And we get calls. If somebody thinks they're going too fast, we'll know about it because people will call us. But we put a lot on them. They know what's expected of the drivers and the supervisors. So, yeah. Okay.
With the wait times at the ER, I know you mentioned it's a national issue. Is that going to get better post-COVID, or I'm kind of thinking through that. Does it affect your service because of the wait?
So it absolutely affects our service. That's why we do that peak time medic unit at Eastport, where if our medic units are out, the crew from that that ladder truck drop over to a medic unit. I wish I could tell you that once COVID slows down more than it has, that it's going to change, but I don't see it. But during the peak of COVID, people didn't want to go to the hospital because they were scared. They were scared to go to the hospital. And we had some very sick people not going to the hospital. I don't know the answer. And you can watch it with society right now with the mandates for the vaccination. There are healthcare workers that were heroes 3 months ago that are losing their jobs. I'm not saying this whether it's right or wrong. I'm not taking that opinion, but I just know that there is a shortage of healthcare professionals also, but it's actually just having the beds in the hospital, being able to move them from that ER to the floor.
Okay.
And
so
we're working it, but it's more of a healthcare issue than it is a fire department issue. For us, we want to get our medic units back in service as quickly as possible.
All right. And your staffing deficiencies, what's the effect? How does that affect response time and also overtime on staffing deficiencies? If we get those staffing deficiencies addressed, how is that going to improve your overtime rate and also your response time?
So what hurts us is, like now we have 8 people in fire school, so we have to pay overtime for those spots in the field. to fill their spots because they're not there. But we're not making that savings in the salary costs because we have to pay their salaries while they're in fire school. While they were vacant and we didn't hire these people, the overtime account was being, supplemented by the salary account there. It's just, it's hard. We balance it. We know what our budget is. We work hard with the city manager and the finance director to do what we need to do. And it causes staffing challenges at times, but right now, we've worked on it and we're within our allotted budget. So when we start running into an issue, that's when we'll get concerned.
Thanks.
But I don't like surprises. I like everybody to know beforehand, hey, this is the issue we're running into, and it's not getting better anytime soon.
Okay. Thanks. And my last thing, we've talked a little bit about the Narcan issue and the opioid issue, and you didn't put it in your performance metrics because it's tracked by EM and the police, correct?
The opioid, yes, there's a separate dashboard that OEM provides that everybody can go to, that you can look at the opioid crisis in the city of Annapolis. The fatalities is what's concerning to us, is the fatalities have not gone down. And
Okay.
that's a concern, but we are seeing that, unfortunately, it looks like they're lacing everything with fentanyl. We are having marijuana issues because people have put fentanyl in it. It's just, it's crazy. And it affects all kinds of families too. It doesn't matter your socioeconomical background, whether you're church-going family. I've seen all types of families. And if your family hasn't been involved in it, I bet you somebody has been, because it's bad. And I wish I had the answer for it.
All right. Well, thanks again. Thank you very much, Mr. Chair. I'm good.
All right, are there any other questions? Chief, why is it takes so long at various hospitals?
It's because there's so many people at the hospitals. They don't have the beds available to move them from our stretchers to a bed. And that's basically what it boils down to. Now, I can't tell you that's because upstairs in the cardiac ward, there are no beds there and they're moving patients out. I know that the federal government has just changed some regulations where they have problems. If you discharge somebody from the hospital and they come back within 48 hours, you actually get fined. The hospitals lose money that way. I'm not saying that that's the issue, but there's just all kinds of issues there. And I just believe it's the pure volume of people needing those services that's causing the problem. You can go out to Anne Arundel Medical Center and see ambulances lined up from Prince George's County to Queen Anne's County, sitting outside. And when they're coming in from Prince George's County, that's backing up things, but that's because their hospitals are backed up. And same for us. Like Queen Anne's County, theirs is an emergency room over on the shore in Queenstown. So they can handle calls, but if you have to be admitted to the hospital, that's not a place you can take them. So depending on the type of incident is where we go, but we'll go to Bowie Health. We'll go wherever we need to do, and we track it. There's a statewide system that tells you what hospitals are backed up and on reroute. But when Anne Arundel Medical Center gets to capacity, then BWMC gets the overload, and then all of a sudden they're on capacity, and then it's Harbor Hospital, and then they're on capacity. So it's just an ongoing concern. Me personally, I think Anne Arundel County's got to the point where we could probably use a third hospital in Anne Arundel County, but that's not for me. I'm just a fire chief.
Wow.
Well, does that mean that patients aren't getting treated while you're there?
No, sir. Our medics they're not the hospital's patient until we get them off of our bed. So they are still being treated by our medics. Our medics can give medications. They are given oxygen. They're monitoring cardiac status. We're handling that. We're just like we do on a scene. It's just they're not being transferred over. But yes, nobody's patient care is being, the patient care that's being affected is that next call that we have to find somebody else to handle.
All right. But if somebody's having a heart attack, you guys I mean, what happens then? I don't,
So if it's a cardiac arrest, they're going to work that, and they're going to make room, whether they have to roll them in on our cot and work them. But they're still going to treat them. It's just a matter of getting them in there to be seen by the physician and getting them off of our cots.
okay. Alderwoman Pendel Charles.
Thank you, Mr. Chair. And I mean, just kind of looking at the news on a daily basis, not only is COVID affecting people physically, but people's ailments are being exacerbated because of COVID and mental health, and just I guess the sheer tension and stress of COVID brings on anxiety and other health maladies. That's kind of what I'm getting, even just generally. So people who normally might feel pretty good, COVID has brought on other things. Does that sound kind of right, Chief?
Yeah, I don't want to give you the impression that just because they're waiting to get into the hospital, they're not being treated. Everybody's being treated and they're getting excellent care. It's just a matter of being able to move them so we're available for the next call, because they're with our medics until that time.
I mean,
All
just
right.
more people going to the hospital for things they weren't going to the hospital for first. That's kind of, I guess, my point.
All right. Chief is, I hate to bring this up, but it's kind of a bugaboo that most members of the public don't really think about. Is suicide prevention an issue with your department?
So we are concerned about the mental health of all of our providers. And part of the challenges the last 2 years have been is that it's, so we have a peer support group within the department. We have a critical incident stress team within the department, and we have a physician who is contracted with us that's available for our people and for our team to get people in the right direction of what needs to be helped. We are very fortunate here in the state of Maryland that the International Association of Firefighters has a center of excellence in Prince George's County, which treats a wide range of issues when it comes to the mental health of our providers, and some of it's for addiction, and that's right here in Maryland. So we have that. We have personnel that are trained to look for some indicators there of our people, and we try to address them as soon as we're made aware that there's concerns. And obviously the city has an EAP program, an employees assistance program that's available. But sometimes firefighters and police officers, they don't like talking to people except for people in our profession. So we have that opportunity for them.
All right. And lastly, at least for me, one of your goals I noticed is to upgrade the police stations. I don't think you've mentioned that. Could you briefly tell us which stations we have and what types of upgrades are you looking to do?
We talked about the 4 stations we're running out of earlier. The Eastport station was built in the 1960s. The Taylor Avenue station was built in the 80s, and the Forest Drive station in 72. The problem we've run into is that, well, we've run out of room in the stations. The stations aren't necessarily built for the number of people we have working these days because of the shift assignments. And the reason we're up to that 140 some people is because our firefighters used to work a 56-hour work week. Everybody around us was working lower work weeks. So they actually added a 4th shift to the department to reduce it. So the firefighters work an average of a 42-hour work week. So that's what it averages down to now, where it used to be 56. But our stations themselves are just old. We've hired more female employees. The female facilities at some of the stations are not real nice. The ones at the Forest Drive station, we converted 2 single stall restrooms that were made for visitors coming in the station to put 1 shower in there. Well, we have several females working every day, so the facilities are bad. So that's the biggest issue we're running in now is just the facilities for our female employees. The Eastport station was old for years. There was a capital project in there to demolish that station and build a new one. That sort of went away just because of city finances. But for a while, we weren't necessarily putting the necessary tender love and care in that building that was needed financially. So there's been a lot of work done to the Eastport station, and we continue to do that currently. And then we have the ongoing issues with like our HVAC systems and items like that the city's continuing to address for us. But that's basically, it's just the living quarters in the stations and some of our storage issues.
Do you get any help in that regard from volunteer organizations, financial help, or, man, woman power?
We do have volunteer companies in the city, and I didn't bring that up, and I should have, because they are a key to our department. The Eastport volunteers are probably our biggest group. We only have a couple riding members, but they provide necessary funding. They bought some of the equipment in that station, which has saved the city of Annapolis hundreds of thousands of dollars because they buy the apparatus we run. They own a medic unit, an engine, or two engines, a medic unit, a pickup truck that has a plow on it, two gators. So they're out there. They're currently working on a project. They want to make a memorial. It's a partnership with them and the firefighters. They want to have a memorial outside of that station so they can recognize people that have lost their lives in the line of duty, and just a place for them to recognize our own fallen heroes. The volunteers have stepped up there. They're doing some donations. So for the Eastport station itself, the volunteers are out there trying to assist, but the buildings are owned by the city of Annapolis, so it's a good partnership. Yeah, they help us a little bit, but there's not a lot of even federal funding out there. There's not a lot for our actual buildings themselves. There's funding out there for other things, but it's not for enhancements of our buildings. We look at all the time. We look at try to get other types of funding in here for the city because we know our financial concerns and our issues that we run into. So we try to take every opportunity we can to bring in additional resources for funding there to help us with our needs.
All right. Are there any other questions? Alderwoman Pendel Charles.
Thank you. Thank you, Mr. Chair. Chief, also mentioning their community resource van that the Eastport Volunteer Company donated to the city, that you were very instrumental in getting help for us to get that piece of equipment. Well, not equipment, but vehicle.
So that unit is in service. It's run out of the mayor's office there. But that was a medic unit that was owned by the Eastport Volunteers that was donated to the city, and they converted that into a community resource vehicle. You may have seen it. It's an older ambulance, but it's got some nice graphics on the side of it for community services. It's got some pictures of some kids and stuff on it, but that's out there to help with some of the public education and some of the issues that the city can address with helping our community. So that's there. I believe the new social worker utilizes it on occasion, and we're anxious to see where it goes in the future.
And great graphic artwork by our local artist, Mr. Commissel Brown. Give him a shout out. Thank you.
All right. Are there any other questions for the chief or for the deputy chief? Well, we thank you very much for being here this morning, Chief. Very informative. Carol, thank you for being here. Also, Deputy Chief Spriggs.
Thank you, sir.
All right. Well, let's move on. Gentlemen, you're excused. Thank you again. And just a minute, let me get my agenda back up here. Sorry for the delay. All right. Next item of business is discussion of the audit committee meeting dates for next year. You should have received some of the dates as they are now scheduled from Ms. Moronsky. Let's talk about them. Let me get those up. And that will take just a minute. We will be meeting next month, although I am not sure whether we will be meeting in December. As of now, I would recommend I will no longer be part of the city council at our December meeting date. However, that doesn't mean I can't plan ahead. I would suggest that probably I would certainly recommend that we not meet on the third Monday of December, but that will be entirely up to my successor. We do have meeting dates in January and for the rest of the year. There are several holidays that come up that we need to deal with. It looks like our meeting dates are January 18th, February 22nd, March 21st, April 18th, May 16th, June 21st, Tuesday, July 18th. I don't know why we would, not sure why we would meet on a Tuesday that month. Well, the dates you all have that Kim sent them to you. January 18th is our meeting date, falls on Martin Luther King Day. And the proposal would be to have that on Tuesday, January 18th. I suppose, Kim, you're listening in, I suppose the alternate dates would be the following Monday. Is that correct? Kim, hello. Okay, maybe we don't have Kim. I think we do, but there we go. Kim, are you there?
Don't know.
Okay. Well, let's just assume January 18th is the best alternate date. It's the next day. Does anyone have a problem with that? Okay. Hearing an enthusiasm. Oh, there you go, Jim. I mean, Mr. Cardillo.
Thank you, sir. A quick question with regards to the April meeting. That's Monday, April 18. It's the day after Easter. Is Easter Monday an optional holiday for city employees?
No, I don't believe. Well, I don't know the answer to that.
No, Jim, it is not.
Okay. I just want to make sure. Good, thanks.
Yeah.
And then, David, do you know the reason for the June 20, June 21 shift? Is there a conflict there on June 20?
I
Could be.
don't know the reason for that.
Probably the MML conference.
What's the date for the Juneteenth? The Juneteenth is on
That could be it.
the 19th.
Yeah, so it falls on a Sunday, so then the holiday moves to Monday.
Yeah, so that's probably why.
Thank you.
You're welcome.
Okay, anybody have any problems with the alternate dates for those months?
No, all good. Thank you.
Ms. George, Alderwoman Pendel Charles, we all okay?
All good.
All right. Thank you, Kim. Thank you for thinking ahead and giving us the calendar to review. Let's see, the next order of business.
Mr. Chair,
Yeah,
do you want a motion to approve the meeting dates as proposed?
yes, I'm sorry. A little early in the morning for some of us. Is there a motion to approve the meeting dates as proposed? All right, Ms. George moves their approval. Is there a second?
I second.
Any further discussion? Seeing none, all in favor signify by saying aye.
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 And there are no nays, so let the record reflect that the schedule for 2022 meeting dates has been approved. Let's see, unfinished business. We do have a vacancy. Actually, we have two vacancies at the moment. One, I hope to propose a name by for our meeting next month, council meeting next Monday night. The young lady from the Key School. I have not, unfortunately, I have not spoken with her yet, but I plan on doing that in the next day or two. Does anyone have anybody in mind or know of anyone that might be willing to come aboard the audit committee? There is a second vacancy. And as of now, I've got one person maybe in mind, but I have not spoken with that person yet. Does anyone else have anybody that you think would be a good candidate for our committee? Well, start thinking and please let me know if you come up with anybody and I'll do the same. I think we ought to.
I noticed something interesting. There's actually somebody that's being proposed for the Financial Advisory Commission that has a very strong audit background. I was a little bit surprised that that person ended up going, and maybe that's the preference, to the Financial Advisory Commission instead of the Audit Committee, which seemed like that person would have been a perfect fit for this committee. So I'm not sure what the background is. I just thought I'd mention that. Jim, I don't know if you know anything about that person. I don't know them at all, but I just saw the resume.
No, I'm not aware of it, but that's great. It hasn't come up in the agendas on the fact yet that there's a possible candidate, but that's great.
Yeah, I think they're up for approval at the next city council meeting next Monday.
All right. Well, I hope to have the person whose name's already in the hat for our position also for next Monday night. The next item of business is, well, really that's about it, I think, for unfinished business, unless there's something that others want to bring up or talk about. All right, our next meeting will be on November the 15th at 8 o'clock, of course. And at this point, it will be by way of Zoom. I enjoy meeting this way. I thought it would be nice if we could get back to meeting in person, but if we can't, we can't. I know this is a lot more convenient for a lot of folks, and I appreciate that. It's more convenient for me too. That commute from the living room to the breakfast bar is, getting a little tough these days, but I've managed, and I assume everybody else has too. Is there anything else for the good of the order?
Mr. Chair,
Yes, Ms. George.
I think we talked about doing a risk assessment perhaps during the November meeting. Is that still a possibility for us?
Doing
A
having
risk assessment?
another department?
No. The audit committee itself doing a risk assessment to see kind of where we want to focus our attention during the balance of this fiscal year.
Okay. Is there anybody want to add to that?
Thoughts, concerns, any of those things?
Yeah, Dave.
I was just going to
City
say,
Manager Gerald.
I think that's a great idea. Katie, maybe you and I and Lynn could meet to sort of put some structure around that over the next 4 weeks. So we'll be ready to do that on the 15th. That makes sense. And whoever else wants to join certainly would be welcome to have that discussion. But I think we should have that in advance, right?
All right. I think I ought to probably be part of that conversation too.
You want to set up a Zoom call, David? Lynn, could we do a Zoom call to make that happen?
Yes, I'm just putting on my list of things to do right now to schedule it. So, okay.
All right. We can do that by way of Zoom. Do we want to have a speaker next month? Another department head?
Well, if we do the risk assessment, that'll probably take our entire meeting time.
Okay. I think I'm going to need to be educated myself. Actually, I'm probably not going to be. It's going to be somebody else's problem by the time after we decide anything.
Else's opportunity.
Yes, absolutely. A great opportunity. Okay. Is there any other discussion? It is 9:15. Do I hear any motions?
Motion to adjourn, Mr. Chair.
Second.
Okay. It's usually my job to make that motion, but I'm the chair. I can't do it. So, okay. Is there any discussion? All in favor signify by saying aye.
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 All right. Motion passes.